So we're going to get started here, and just a couple of house cleaning items. If you would please, if you find it for some reason the audio gets a little weak and bounces around a little bit, just go ahead and remove. I'd love to see your faces, but you could mute your video. Might give you a little bit better bandwidth and it's real clear. So that's just a thought. And for now, we'll just have you go ahead and mute ourselves, but humor me a little bit. If I could get everybody that has their screen there I want to get a screenshot of everybody, but I want them to smile because sometimes people are concentrating and sometimes they're sitting back in their chair and that, but if you could humor me, I'm going to do a quick screen share in 1, 2, 3, smile. Man, look at those smiles. Thank you, Sonia. All right, thanks. Okay, so as we go here, the chat box is there to communicate. If you have questions or comments, and we'll be running that on the side as well. We have a very special guest that David will be introducing. A couple of other items too is we'll do our pledge in just a moment, but our regular meetings will continue at 11:30. We do have our Rotary Means Business coming up this Monday evening at the same time at 6 p.m. And then Diane wanted to make sure that I made an announcement that our board meeting is going to be on April 21st. And by golly, I'm guessing that'll be virtual as well. So just a little information about that. For birthdays coming up, tomorrow is Elizabeth Burnett's birthday. Gosh, I think I got another one, a double nickel on the 20th. D-Rock Booth, Derek is 26, Paige 27th coming up, and Joe on the 30th. So with that, let's kick off with our invocation and a prayer. God be with us as we serve our community through Hall County and around the world. Guide us to those whose cries for help we cannot hear, and show us how we can put serving their needs above the needs of ourselves. In thy name we pray, amen. With that in mind, welcome everyone. Glad that everyone is here. If you have any specific announcements, go ahead and place those in the chat box. At the end of our presentation, if our local public safety groups, including the health center, have any announcements, I'll open it up for you to share as well, which I think is very, very important. But with that, I'm going to turn the agenda over to David Stovall. David.
Hey everyone, it's so great to be with you again, and I'm excited about a lot of our guests. We have some district leadership here, but we also have our director, Stephanie Yurchik, on the phone all the way from Pennsylvania. Welcome, Stephanie. Great to have you with us. And our very special guest today is Michele Berg, who's the Deputy General Secretary of Rotary International. And yes, that is impotent. Michele joined Rotary in 1992, and she and I met just a couple or 3 years after that. So I've known, Michele wouldn't want me to say this, but I've known Michele for over a quarter of a century. And she was just out of high school when she joined. So she's not that old, but she does manage. She'll talk to you a little bit about the numbers, but she is basically second in command at the Rotary International at One Rotary Center over in Chicago. A little bit of interesting background with Michele. She graduated from Loyola University with a major in Italian. I found that so fascinating. We're going to have to let you speak Italian to me next time I'm in Chicago, Michele. I'll just sit there and love listening to Italian. And then she has an MBA from the University of Illinois in Chicago. And with that, I'll turn it over and let's give a big virtual clap to Michele. Welcome, Michele.
Hi, everyone. It's good to see your faces. Can you hear me okay? Okay, great, good. Well, I'm happy to be here with you, and I find this to be a very interesting part of the situation today, that actually we can connect with more people all around the world, and it's really lovely to be able to see all your faces this morning. So as Director David said, I am a Rotarian and I'm a past president of the Rotary Club of Evanston. We're the home club. We meet there at the headquarters in Evanston at the building. And as David said, I'm the Deputy General Secretary, which is like a Chief Operating Officer. I have worked for Rotary for a long time, for over 20 years. And I can literally say Rotary is just a huge part of my life. I met my husband at Rotary. He used to work there. My sister works at Rotary. Her husband used to work at Rotary, and I think my parents thought that maybe there was nowhere else to work in Chicago than at Rotary. My father actually joined Rotary based on the fact that we all worked there. He figured he better check it out. So he is actually now a member of the Rotary Club of Evanston with me. And when I was president, I had the pleasure of inducting him into the Rotary Club of Evanston. So it's pretty neat. I love working at Rotary and I love supporting the efforts of clubs around the world. So thank you for the ability to join your club today. So when I started at Rotary, I've worked in a customer service type role, and that was in 1992, as David said, dating me. And now I oversee kind of all the operations in Evanston and in our 6 international offices, and that includes kind of the management of the building, and we own the building in Evanston, and we lease other properties for our other offices. It entails our human resources function for all employees around the world. I also support the board and trustees and presidents, the senior leader support we call it, and then any other issues that come up to the General Secretary's office, and when he's traveling or he's otherwise occupied, anything else that comes up for the CEO. So we have a terrific staff in Evanston. I don't know how much you know about it, but I thought I'd just give you a little bit of information about the Rotary Secretariat, as we call it, or the staff team that supports Rotary efforts around the world. You know, we have a very talented staff, professional staff. We have most of over 40% of our employees have lived outside of the United States for over a year, the employees in Evanston. So we have very international team. Over 300 of our staff speak a language other than English. And we have 14 different languages spoken among the staff. And now I'm just talking about the Evanston-based staff. We handle over 30,000 phone calls a year from our support center. And our support center has been named Best Support Center for 4 years in a row by this benchmark service that reviews support centers, call centers. And so we are an award-winning support center, which is wonderful. We receive over $300 million in contributions in multiple currencies. We process over 1,000 grants a year. We manage an online learning center with almost 100,000 users, and that has obviously expanded in this situation now. So we've really done a lot of webinars, over 50 webinars held just in the last 6 months, and I'm sure in the last month that's increased quite a bit. And we've translated over 24,000 pages this year and offered over 4,000 hours of interpretation. So we produce a magazine and a website and social media channels, all in over 13 languages. So I'm really proud to belong to a staff team in such an international group that I hope you see as your partners in service. We're here to help you and support the mission of Rotary. So David asked me to talk a little bit about how the staff team is doing during this situation, during this pandemic. And certainly the coronavirus has created a humanitarian crisis, and this is a serious threat to especially the most vulnerable in our populations. And protecting the health and safety of our employees and our communities has been job one for your leaders and at Rotary. And this event has certainly been a disruption to many businesses around the world, and it's been a disruption to Rotary as well. I want to say that we started tracking this issue in January, when some of Rotarians in China and Korea began to be impacted by this. And by late January, we had a staff team dedicated to reviewing the virus and how it was spreading and how it might impact us. In mid-February, we started meeting daily with a team, a cross-functional team, again, we knew that this was going to be impacting our operations, our office. We have an office in Japan, an office in Korea. So in about mid-March, we actually, we called a test of a work from home situation for the Evanston staff. We said, let's take Thursday, everybody work from home. On Friday, come back, get anything that you missed, and then we'll probably go to work from home the next week. But there were a couple of significant announcements that day on March 16th, and we ended up telling people to just stay working from home. So since mid-March, we've had all the employees in Evanston, and then later, many of the offices followed. We've been working from home. So we said that we were a little bit ahead of the curve and flattening the curve. We took our steps pretty early on this. And to date, we've only had 5 staff globally who've developed, has cases of COVID-19. So, and one of those individuals has already recovered. 4 are from Evanston and 1 in an international office, but all are doing well, and many of them are still even working. So, you know, that we've been lucky. And since those cases started over 2 weeks after we closed the office, we're pretty confident that as an employer, the actions that we took protected our staff, and they were likely exposed to from family members or from other sources. So on the volunteer side, we also took some pretty good actions, I think, to quickly protect our travelers, our volunteers, our program participants. All domestic and international Rotary funded travel was suspended, and that was in late March as well. And we suspended that through 30 April. It's likely to be extended here as we get towards the end of April. We had a board meeting and trustee meeting by webinar rather than having them in person. We had them both were intended to be in April. So the transition to working from home has been relatively smooth. Many years ago, we had already gone to laptops instead of desktop computers. It's part of our emergency response, just in case there were ever an issue in the building or we couldn't have access to the building. So we'd already had the ability to work from home. And we've gone mostly paperless in the office. A lot of our processes are done online already. So we were well positioned to move to work from home, and pretty much all of our functions can continue. Our club and district support teams are doing even more than they've done before, connecting with their district governors, holding sessions on how to use Zoom to conduct your meetings, and helping clubs continue to meet. Our PR teams, our social media teams, fund development, of course, the COVID disaster response fund that the trustees approved has been a big activity that we've supported, and we're glad to see that it's been successful, and a lot of contributions received from that and a lot of grants given out. So there's just a couple of things that we cannot do because we don't have access to our building. So for example, recognition materials, Paul Harris Fellows, we cannot get to the building to mail those out. So that's one thing that we can't do physically. We've, a couple of our resourceful employees made digital Paul Harris Fellow pins that they're helping to give to clubs who want to still proceed with presenting those recognition items. So we've had to be creative. We obviously can't get to our archives, so we can't do some research and things like that. Some of our service awards that might need physical awards are also limited. So we continue to monitor the COVID outbreak on a daily basis. We still want to make sure that we stay ahead of this, and in terms of exposing our employees, our volunteers, our program participants. And of course, we try to keep you all informed. We update our website very regularly with any updates and developments. So I guess with that, I'll stop and see if anyone has any questions, and if there's anything else I can answer.
Thank you, Michelle. If you have questions, go ahead and just put them into the chat pane if you have that capability. If not, give me a wave and I'll see you and I'll call you in just in a minute. There is a question already that came private to me about COVID-19 versus polio plus. You mentioned the COVID emergency fund, a couple of items there. Would you like to talk a little bit about where we stand with polio plus and COVID-19?
Yeah, and you can jump in here too if you have more details at handy. But we had to suspend some of our polio eradication initiatives, obviously because of health and safety issues with the vaccinators. So, and that's obviously quite unfortunate. We obviously need to get to every last child and immunize them against polio. So we've had to take a pause for that. But we are using some of those same networks to help with testing and the research for vaccine against COVID-19. And so the networks and the structure that was created for polio has, I want to say come in handy. That's probably too light, but it's been a resource for us as we help to combat coronavirus as well. So David, is there something else that you had in mind?
A couple of things might add to that. I believe the WHO has now suspended that formally for us. And also along that line, Michelle just talked about the structure and the infrastructure. The infrastructure of Polio Plus has been invaluable to the CDC, the WHO, UNICEF, and others. And we've been saying this, our model could be applied to anything. And we're now seeing that with what they're not having to reinvent the wheel, so to speak, on that. Second thing, Michelle mentioned the COVID Emergency Disaster Relief Fund. The trustees contributed, I believe it was $3 million to that.
Right.
Initially. And I just found out this morning, it was called with an ask, call to action aspect part of it. But on Sunday, April the 26th at 11 a.m. Eastern, there will be a virtual fundraiser live on a number of platforms, live on Zoom, streaming to Facebook, all over the world. It's for Rotary's Disaster Relief Fund for the COVID-19. We don't know how much money we can raise in an hour, but we think it will be in the millions for if you start out and take 100,000 people that gave only $10 a piece, that's $1 million. So we will have it translated in a number of languages, simultaneous translation, and people will be speaking in their native tongue so that we've got all of the languages of the Rotary world represented, but be looking for more of that on social media. If you're not a member of our Rotary Zone 3334 Facebook group, please go there and like that and add it to your feeds. Just yesterday, I posted a link to a website for Project Surge. This is not an official outbreak, if you will, of Rotary staff or senior leaders, but it is a grassroots campaign to get 1 million volunteers in a virtual mode to be assisting people. It also includes personal involvement if you wanted to do that. Things like Sonia and them do every day. There's a 30 or 35 hour class that you take and you become basically a certified nursing assistant into this program if you want to go live face to face. So go there and look at that, check it out, and we'll go from there. There's a question from Lona, how will these funds be distributed? We started out with the opportunity for clubs, districts to get a $25,000 grant through an application. Michelle, could you touch on that?
Yeah, we had $25,000 disaster response grants available, and it's limited to two grants per district. And I think it's we received 118 applications, I think, within 48 hours. It was a very quick uptake of the opportunity. And at first, the trustees had put aside $1 million for that, and obviously that was quickly depleted. And they since added another $2 million to that fund, and we've raised, let's see, almost $600,000 from 3 sources: from direct contributions, cash contributions, from DDF donations, and from convention registrations being refunded. You have the opportunity to contribute your convention registration refund to COVID-19. And so almost $600,000 was also raised for the fund from Rotarians around the world. And so we still have not been able to fund every request. So there's still a need to continue to fundraise.
And I think that virtual event will raise multiple $1 million. I didn't mean to undersell it when I said $1 million. We're expecting millions of dollars there from that effort. Any other questions of Michelle? Raise your hand if you do, wave your hand. Well, I've got to say this on behalf of Michelle. Kim and I have been very humbled to serve on your Rotary Board of Directors this year and last year, and get to know Michelle better and a lot of their staff. And I tell you, the staff of our Rotary International and our Rotary Foundation, I'm not saying this because Michelle is here. Stephanie will be shaking her head up and down. They are the most phenomenal group of people to ever work with. Before I went on to the board, when I was a director-elect, I'd think of things at 6 or 7 o'clock at night, and they, you know, in the South, they say, break that dog from sucking eggs. Well, that's kind of what they did to me. And I say that lovingly because I'd think of something that I'd have a question or a comment to one of the individual staff I was working with, and I'd email he or she at 8 o'clock at night thinking they'll get it in the morning. Well, it's 7 o'clock back home, and invariably in about 5 minutes, I got an email response back. So they broke me from sending them emails late at night because I knew they would respond that night. And you see Michelle smiling now, they are always smiling. They're just a happy family there at Rotary. Michelle, we honor you. We appreciate all you're doing, leading our organization. And we thank you so much for being with us today.
Thank you so much. It's nice to
Big
see all
virtual
of you.
clap for Michelle.
Thank you. Thank you.
Thank you, David. Thank you, Michelle. Very much appreciate your update and sharing your insights. And now we know that we can send emails at any time, day or night, and somebody will reply from Chicago, or at least from Rotary International. With that, I think we have Adriana. I just want to acknowledge that you've joined in. She was our GRSP student 3 years ago, was it? I have to think. So it's great to see you, and your hair is much longer. So great. You look terrific. You look terrific. With that in mind, I just have a couple of announcements. I'm going to turn the microphone over to Sonia and then to Eric to make some announcements, if you would. And so, ladies first. Sonia, you're up.
Hey, everybody. It's great to see you all virtually. I wish I could see you in person. The social distancing thing stinks on many levels, but it really stinks because I can't give you all a hug. But I want to first thank the club. The club made a very generous donation to the Northeast Georgia Medical Center COVID-19 fund. This fund goes to help all of our efforts in this crisis, and specifically it helps us provide meals to our staff. Some of you guys have seen some of the pictures on Facebook of what the staff looks like who are caring for these patients. They are zipped into thick yellow Tyvek suits that they wear for their entire shift. We literally zip them in, tape them in. They wear 2 pairs of gloves, a bonnet, a face shield, an N95 mask. They wear them for 4 to 6 hours. During that time, they can't eat or drink anything. Then we unzip them. They're soaking wet. They're starving, and they can't leave the floor. So what this donation helps in part to feed them every day, because they can't leave the unit, and to keep them hydrated. It also helps us provide iPads for each one of the floors, because of course we don't allow visitation anymore. So we have iPads that allow family members to interact with their patients. So we have Zoom meetings for patients to interact with their families, and also physicians to interact with family members. We have really good interactions now. This helps not only our regular patients, but also our limited English proficiency patients. A very high number of our COVID positive patients are from the Hispanic community. So we're able to have 3-way conversations with our interpreters, our physicians, and other caregivers, and with family members with patients. So it really does help. So that's another way that you are helping. We've also implemented nurse navigators with these funds. So many different ways that this goes to help. So thank you very much for that generous donation. Also want to have a shout out. If you guys are bored at home and you want to have a sewing project, this is what I look like all day long. So we are all wearing masks, all 10,000 of us here at the hospital. So if you want to sew a mask, we have sewing instructions on the NGMC website, and if you want to make a cloth mask, we'd love to take them. We cannot have too many because we've got to wear a new one every single day and then take them home and wash them. So another way to help. We are anticipating a surge coming. A couple different models show that our surge could be anywhere from April 20th all the way into the beginning of May. And we don't know exactly what that number is going to peak out at, but we've been very fortunate in our planning. So we will be using the potential for all of our NGMC campuses, for all 4 acute care campuses. We will also, if you saw the Gainesville Times today, the governor will be sending us a mobile ICU that will go on the Gainesville campus in the North Tower parking lot. That should arrive the first week of May. The state will actually be staffing that, but that'll be another 20-bed ICU. So very exciting things happen. So we feel very confident that we will be able to care for our community. One of the limiting factors for us has been testing. We are able to do some COVID-19 testing in-house now. Most of that goes to Alpharetta and has a less than a 1-day turnaround, but we're able to do some 1-hour turnaround right here on the Gainesville campus. And we're also experimenting with some antibody testing. You've probably heard some of that on the news. So we're getting ready to start sending some of that out. And of course, when that is widespread, that will really help us be able to control this when we really know where the hot spots are. So that's some of my highlights, but I'll be glad to take any questions that you have.
So Sonia, how many iPads do you have in your at the health center now for folks to be able to see their families and communicate? I'm just kind of curious about that. And do you still have a need for iPads?
So we have a pretty good supply right now. We're able to meet demand. So thank you very much for asking. We've got about 25 deployed just for family interaction right now, in addition to the ones that we use for interpretation and for patient care.
All right, fair enough. Thank you very much, Sonia, for the update, and great to see you as always. Eric, I'll turn the floor over to you if you've got any announcements from the Gainesville Fire Department. I trust you're doing well, my friend.
Yeah, thank you very much, Al. I don't really have any public announcements from the fire department. Unfortunately, I wasn't really prepared for announcements. I'm just enjoying the information right now. I would say we're kind of doing business as usual here, if that's possible, with regards to our daily operations. They're somewhat the same, if not just, I guess we have a stricter use of PPE on a lot of the calls that we're running. The personal protective equipment that we wear, we seem to change our guidelines weekly, if not daily now, just based on how the situation changes. The fire department, as you may know, as well as other city buildings, we've kind of closed everything to the public, so we don't have any interaction, with the public. We're not doing fire station tours and those types of things right now. We're basically just focusing on meeting the needs of the public and our customers in that regard. And that's pretty much it from the fire department. Al, you might have muted yourself. I can't hear you.
Yes, I did. Pay attention. So, yeah, if there are any other announcements, go ahead and put those into the chat box for everyone. Or if you want to raise your hand and make your announcements now, that's fine too. Just unmute yourself.
Lona has an announcement, and then I have one more.
Okay, Lona, the floor is yours.
Thank you, Al. Hello, everyone. So good to see you. I wanted to confirm with Sonia in that we did make that donation to the hospital, as well as we made the same amount of donation to the Georgia Mountain Food Bank. Diane has been putting that together. She picked up the checks and delivered those on Monday. We have sent out a challenge to the other two Rotary clubs in Hall County, the Rotary Club of Gainesville and South Hall, to match those donations. So we're hoping we can get some more money from that, because as we all say, we're in this together. So we're hoping to get some response from that, because we do want to support our local entities and definitely our heroes. So thank you for allowing me to announce that, and I will keep you updated if we get that money matched.
Terrific. Thank you, Lona. And I think that's a great idea. We'll see how that challenge works for the benefit of all. So thank you again, Lona. Any other announcements? I'll look for hands to come up.
There's a question of the family member was admitted to Northeast Georgia not COVID-19 related. How does she request a conversation via iPad with him, Sonia?
Yes, that is a great question, Paige. All she has to do is ask her nurse, and they ought to be able to set that up.
And very good. And just noticed that our director-elect following me is Peter Kyle, and he was on another call, but he did make our call and caught part of it there. So welcome, Peter, Director-elect Peter. It's great to have you with us. And I do have one public service announcement for Michele Berg's benefit. She mentioned that she is a past president of the Rotary Club of Evanston, correct? And Michele, doesn't your club have a really special event coming up on May the 1st?
Oh, yes, thank you. We are celebrating 100 years on May 1st, and we've moved our gala event to be a virtual event. So all of you are welcome to attend, and I invite you all to come and celebrate 100 years with us.
And I hope that some of you will think about joining Kim and I at that event. It's going to be a great time. I think it's 1920s attire.
Yes, we were doing kind of the roaring 20s, roaring 2020s theme. So we're just now working out the logistics of how we can make that happen. We had originally postponed it to August, and we had a date and contract to have the event in person in August, and then the hotel that we were having it closed until September. So we quickly changed gears, and we're just now putting it up. But if you want to follow us on Facebook, it's Evanston Rotary, Instagram, or our website is evanstonrotary.org.
And thank you, Michele. We wanted to get that PR announcement in there for you. And there's an announcement on the chat in case you're not seeing the chat. Jean Cornett, who's been joining us the last few weeks, is having some health challenges, and her birthday was on Sunday. Her telephone numbers are on the chat if you'd like to reach out to her, and the club has sent her a birthday card. With that, back to you, Mr. Rao.
Thank you, David, very much. With that, any other announcements before we wrap up with the four-way test? All right. Well, I got to participate with another club this morning. So just for fun, let's just keep our phones muted, because when you have a large number of people and all the timing on it, it really sounds kind of wonky, I guess. So for that, let's all say the four-way test of the things we think, say, or do. Is it the
The
truth?
truth. Is it fair to all concerned? Will it build
Goodwill and better
friendships?
friendships? And will
Will
it
it
be
be
beneficial
beneficial
to
to
all
all
concerned?
concerned?
All right. Thanks, everyone. Look forward to seeing you soon. So long for now.